with NM43 from the IC class. And for today, I will be the one who is mind the passion to check about the radiograph interpretation skills. So for the first, our hand hygiene. So for the first, open the water tap. Rub the hand, rub the back of the hand leaving the finger, rub the palm and leaving the finger. The inner finger is in the rub. Rub the left palm by rotating off the palm and the other side. Rub the left palm by rotating on the fingertip and the other side. And after that, close the water tap with your hand. After that, our greeting and also the introduction to the patient. So good morning, Miss. For the first, let me introduce myself. My name is Dr. CECILIA. And for today, I will be the one who is reminding you to check you about your radiograph interpretation skills. Is there any abnormality in your heart, or maybe is there any fracture or not? So we must to check about the radiograph interpretation skills. So image radiograph is also the skill to establish the diagnosis of the patient. And after that, I must to already placing the radiograph in the radiograph box like this. And check. Then there is no name, but the old or the years old is 56 years old is man, and also the date of the check radiograph is 26 on December 2016 at 12 and 50 a.m. For the next, we must check about the school or the cranium. For the first, we must to evaluate the image adequacy of the school AP. The first, the adequate X-ray penetration, and after that is symmetrical without rotation. And for the next, the right and left orbital rings appear symmetrical, and the petrous bone is overlap the orbits. And for the next, we must to evaluate the image adequacy, the skull in the lateral position. For the first, the adequate X-ray penetration is normal. The mid-sagittal plane parallel to the detector. The cerebrospinal is clearly visualized, and the both temporomandibular joint, or the T and G, are superimposed. For the next, we must to access the radiologic finding for the skull AP or the lateral. For the next, is about the cranial bone alignment is normal. The bone integrity, there is no fracture and is intact. Because the bone integrity, the color is more like more white, not gray. And for the next, it's about the tabula interna or externa and diploid is normal. The suture and vascular marking normal. The pathological classification is absent, so it's normal. And for the conclusion, there is no fracture observed in the visualized calcareous bone, so it's normal overall. And for the next, we must check about the cervical vertebrae. For the cervical vertebrae, you must check the first will be to evaluate the image adequacy, the cervical AP. For the cervical AP, the adequate penetration normal, and the spinous processes midline we can look is normal. Equidistant pedicle is symmetrical and there is no rotation. And for the next, we must check about the evaluate image adequacy, the cervical lateral. For the first will be the adequate penetration, the visualization from the C1 to C6 until C7. And the next, the vertebral bodies is superimposed, and the articular fascia and cervical joints is superimposed. And the next, we must check about the access finding, the cervical AP or the lateral. The first, the cervical vertebra is visible, C1 until C6. It's normal. The cervical curvature is normal. There is no listhesis. The listhesis is usually in the anterior or posterior listhesis, but in this image there is no listhesis. And for the next, the bone integrity is intact. There is no fracture. And the bone density is normal, no osteoporotic, and the pedicle is intact. And for the next, there is no signs of the fracture, destruction, or leaking. There is the branches of the bone spurs, and also the invertebrate disc space of the foramina is normal, so it's normal. And for the next, is for the facet joint normal, the surroundings of tissue is normal. So for the conclusion, there is no cervical vertebrae, fracture observed in the visualized segment. So for overall, it's normal. For the next, we must check about the thoracic vertebrae. The first, we must evaluate the image adequacy, the thoracic from the AP. From the AP, it's normal, adequate penetration, the intervertebral joint clearly visualized, and also the spinous process equidistant from the sternoclavicular joint. So it's normal. And the next will be to evaluate the image adequacy. The first will be the thoracic vertebra. For the penetration, it's adequate, it's normal, and after that, for the intervertebral joint and neural foramina is open, the spinous processes and posterior ribs is superimposed, it's normal. And for the next, we must check about the access finding, the thoracic AP or the lateral. For the first will be the vertebrae T1 until T12 is visible, and the next, the alignment and also the curvature is normal. There is no listhesis. The listhesis is absent, no anterior or also the posterior listhesis. And the next is about the vertebral integrity. It's intact, density normal, pedicle is intact. There is no sign of the fracture, lytic or plastic lesion. So overall, it's normal. And after that, there is presence of the bone spurs and narrowing of the disc space of the foramina. The paravertebral soft tissue is normal. So for the conclusion, for the thoracic vertebra, there is no fracture that we observe in the visualized image. So there is no abnormality. So for the lumbosacral vertebrae, the first we must evaluate the image adequacy. For the lumbosacral AP first, its adequate penetration. We can see the L1 until S5, the spinous processes and also the sacroiliac joint, and the iliac being symmetrical. There is no rotation. The intervertebral joint is visible. And for the next, we must check about to evaluate for the lumbosacral lateral. The penetration is normal, it's adequate. We can see the L1 until S5, the greater static nodes is superimposed. And for the next, we must check about the lumbosacral AP or the lateral. L1 until S5 visible. The alignment of the curvature, okay, normal. There is no listhesis. The vertebral integrity intact. Density normal. Pedicle intact. Evidence of the fracture. There is no fracture. The bone spurs is absent. The bone spurs is normal. It's present. And the narrowing of the intervertebral disc or space of the foramina. The lumbosacral and sacroiliac joint is normal. The paravertebral soft tissue is normal. So for the conclusion, there is no lumbosacral fracture that we observe in this image, and for overall, it's normal. There is no adequate exposure or decollimation, and there is no major artifact. So it's normal. And it's AP projection. And in this image, it's about the thorax. This is the image of the chest or the thorax. So for the evaluate the image adequacy, this is based on the image. The penetration is adequate, and after that the rotation is symmetrical. This one is the clavicle, it's symmetrical, and after that the inspiration is adequate. There is no magnification because based on the heart, the magnification is IC 75%, so it's still in the normal range. It means there is no cardiomegaly. And after that, for the angulation, it's absent. And the entire chest include is normal. And for the next is for the assess the finding. For the cardiac size, I also mentioned it. It's 75%. And for the cardiac size, we must to check the longest part of the cardiac in this side per the longest part of the diaphragm in this side. And after that, the aorta and also the superior mediastinum. This is the aortic knob. It's not dilation. And after that, for the trachea, is located in the midline position. We can look at this spot. It's a little bit gray, a little bit not too white in this spot. And after that, there is the hilum or hilum in this spot. It's not thickened. And for the pulmonary vascular marking, it's normal. And for the parenchyma, there is no infiltrate, nodulus, fibrosis, cavities or other lesion. For the diaphragma contour is normal. And for the costal-radic angle, this is the costal-radic angle. We can see this is not too sharp, it's normal. And for the soft tissue, there is no foreign bodies and also the subcutaneous emphysema. We look this, there is no emphysema. If there is the emphysema, the color is more like a dot in this part, but there is no emphysema, right? And for the next is about the bones. The bones is intact, there is no fracture. If we look at the clavicle bone, yes. And for the next, we can look at the patient inspiration based on the part of the bone. 1, 2, 3, 4, 5, 6 is normal. And for the next, for the convolution, there is no radiological abnormality detected in heart and also lungs. And there is no rib fracture seen, so it's normal. And for the abdomen, there is for the evaluate image adequacy for the supra-abdominal AP. The first will be the adequate penetration. It's adequate and asymmetrical of the ribs, the iliac crest and also the obturator foramina. And there is no motion of the artifact. And after that, there is no abnormality. And for the assess of the finding supra-abdominal AP, the first will be the pre-peritoneal vein lines will be clear, indistinct and not visible. And for the source line, it's sharp, it's symmetrical. And for the renal contour, it's normal. And for the bowel gas, it not reached the rectum, so it's normal. And for the signs of the bowel dilation or wall thickening, the free extraluminal air is absent. The soft tissue masses is absent. The radio-opaque calcification along the urinary tract is absent, and the bones is intact, so it's normal. And for the conclusion, no abnormality detected in plain abdominal radiograph. And for the next is about the extremities. For the extremities, the first will be to evaluate the image adequacy, the extremity of the radiograph. For the first, the adequate penetration. The penetrant is adequate, it's normal. And for the next is about the anatomical positioning. It's 8P. And after that, the assess of the finding extremities. The bone is normal, the subluxation or dislocation is absent. The fracture, there is no fracture. The bone stool formation is normal. The joint space is normal. The surroundings of tissue is normal too. And for the conclusion, there is no abnormality in the extremity fracture. So there is no fracture in the extremity and there is no abnormality that we observe in visualized bones. So we must to take off this radiograph. And after that, we must to explain to the patient that overall from the skull, the chest, the abdomen, And also the extremities and the other part is still in the normal range. There is no fracture and overall is normal. And after that, we must to ask the patient, is there any question? And if there is no question, we must to deliver all of the medical record of the image of the radiograph in the medical information of the patient and education in the medical record. For the next, we must to conclude with greeting and thanks. So that's all for today, Miss. And if there is no question, that's all and thank you. And after that, we must to follow by the hand washing. For the first, open the water tap. Rub the hand, rub the back of the hand, leaving the finger. Rub the palm and leaving the finger. The inner finger is in the rub. Rub the left thumb by the tip of the palm and the other side. Rub the left palm by the tip of the fingertip and the other side. And after that, close the water tap with your hand.